If you've been living with neuropathy and you're not sure whether your nerves are actually healing, these two simple 10-second tests will show you. In this video, I'm going to walk you through two quick self-checks that you can do right at home that reveal whether your nerves are starting to recover, even before you feel normal sensation again. Most people assume if the tingling or the numbness hasn't changed, that it means that there's no progress, but that's simply not true. Nerves heal slowly, and the first signs of recovery usually show up as small changes in strength, coordination, or light touch, long before the pain can even disappear. So if you do these tests and notice one specific reaction I'll show you, that's your proof that healing has already begun. And if you don't notice it yet, stay with me, because by the end of this video, I'll show you exactly what that means and how to restart your nerve recovery naturally. Hi, I'm Dr. Ole Olson, America's neuropathy coach and founder of Asuta Health Neuropathy Centers. This is one of the only channels on YouTube entirely dedicated to helping people with peripheral neuropathy finally get lasting relief. Please subscribe now if you're looking for natural relief, proven daily routines, and real-world solutions that actually work. You're in the right place. At Asuta Health, we help you move better, feel better, and live with less pain every single day, because you matter. Most people with peripheral neuropathy assume that if their feet still feel numb or tingly, that nothing's improving. But healing often begins way before those sensations return. The first signs show up in how your nerves respond to touch and movement, and you can check that right now with two quick at-home tests that take about 10 seconds. These are simple screening tools that doctors use to track nerve recovery. They're safe, easy, and don't require any special equipment. Just remember, these tests don't replace professional medical care. They're designed to help you understand your progress, so always consult with your healthcare provider for diagnosis or treatment. Let's start with the first one, the sensory nerve test, light touch. This first test is going to tell if your brain and your feet are communicating properly. Take a cotton swab, a tissue, or even your fingertip. Make sure your feet are clean and dry, and then go ahead and close your eyes. Now, gently touch the top of your big toe and the top of your foot. This is even better if it's done by someone else. Now, ask yourself, can you clearly feel that light contact? Or does it feel dull, fuzzy, or missing in certain spots? If you can feel that gentle touch, that's a great sign. It means your sensory nerves are sending signals up the line to your brain and starting to reconnect. That's what real healing looks like. Not just less pain, but restored communication between the nerves and the brain. If you can feel the light touch but your feet still feel numb, that's actually common. It means the larger nerves that detect pressure and contact are working, but the smaller nerves that sense temperature and fine detail are still catching up. That's still progress. It simply takes time for all the nerve fibers to fully reconnect. But if the touch feels faint or patchy, that could be a red flag that those nerves are still under stress, usually from ongoing compression, inflammation, or even poor blood flow somewhere else along the pathway. This simple touch test is based on what's called monofilament test, which doctors use around the world to check for nerve sensitivity in people with diabetic or peripheral neuropathy. It's one of the gold standard ways to see if those small sensory fibers are functioning. So when you do this at home, you're not just guessing. You're using a similar type of screening tool used in clinics around the world, and it gives you a real window into how well your nerves are communicating. And if you couldn't feel that touch today, don't panic. That doesn't mean your nerves are permanently damaged. It simply means the signal hasn't come back yet. And that's exactly what we'll focus on improving later in this video, when I show you what to do next and how to restart your nerve recovery naturally. The second test is the toe lift motor control test. Now let's move on to the motor nerves. These are the nerves that control movement and strength in your feet and toes. They're just as important as the sensory nerves because they show how well the communication from your brain to your muscles is working. Sit down in a comfortable position where you can clearly see your feet. Now, go ahead and try this. Lift all of your toes upward toward your shin and hold them there for about 10 seconds. As you do this, pay attention to how it feels. Are you able to hold your toes steady the whole time? Or do they start to shake, fatigue, or drop after a few seconds? If you can hold them strong and steady, that's an excellent sign. It means your motor nerves are active, your muscles are getting a clear signal, and the healing process is already underway. Even if you still have some numbness or burning, this is proof that your nerve pathways are reconnecting and starting to function again. If your toes tremble, fatigue quickly, or you can't lift them evenly, don't get discouraged. That simply means this nerve signal is still weak, or it's being blocked somewhere along the pathway. This is very common in peripheral neuropathy, especially if there's compression near the ankle, the knee, or even in the lower back. This toe lift test is one of the same checks doctors and physical therapists use in neurological exams to assess the perineal and tibial nerves. Those nerves control the movement in your feet, balance, and stability. So being able to move up and hold your toes in this is a major indicator of progress. And just like the light touch test, this isn't a diagnosis, but it gives you a clear snapshot of how well your nervous system is functioning today. If you struggled with this test, that's okay. It doesn't mean your nerves can't recover. It just means that the signal needs more help to get through. And later in this video, I'll show you what you can do to help your nerves restart the healing process naturally. So now that you've done both tests, let's talk about what to do next, especially if your results weren't normal and your nerves still feel stuck. If you couldn't feel the touch or your toes were weak during the lift, don't worry. That simply means your nerves are still under pressure and the healing signal hasn't broken through yet. The good news is there's a lot that you can do to help that process start again, safely, naturally, and often right at home. If you're working with a doctor who focuses on treating peripheral neuropathy, they can help you create a program that targets the real causes of nerve damage, not just the symptoms. That usually includes improving circulation, releasing nerve compression, reducing inflammation, and rebuilding strength and coordination in your feet. If you're starting at home, here are some of the most effective strategies that you can begin today. First, do balance exercises like single leg stance and heel to toe walking. These improve stability, increase blood flow, and retrain your brain and nerves to work together again. Secondly, boost circulation to the feet with regular movement and simple exercises, such as walking, ankle pumps, toe curls, and light stretching. Gentle self-massage also helps bring oxygen and nutrients back into the nerves. Third, pay attention to diet and supplements. Nutrients such as alpha-lipoic acid, B vitamins, and antioxidants support nerve repair and reduce inflammation, while certain foods can actually make your symptoms worse. I've made detailed videos that show you what to eat, what to avoid, and how to make simple daily swaps that help your nerves heal faster. Finally, protect your nerves with good home care. Wear comfortable shoes, keep your blood sugar stable, and manage sleep and stress. Small habits like these make a big difference over time. And if you want to go deeper into any of these areas, you can find all of these strategies right here on my channel. I'll link some of the top videos in the description below, including ones on exercises, diet, supplements, and even home care routines that are easy to start today. If you're new here, this channel is about helping you understand peripheral neuropathy, track your healing, and take safe, natural steps toward real recovery. So don't give up. Even if your tests today weren't perfect, you can improve. Every week, thousands of patients regain feeling, balance, and confidence using these same strategies, and you can too. You now have two simple but powerful ways to track your nerve recovery right at home. Remember, these are just screening tests. If your results weren't normal or you're unsure about what you felt, be sure to check with your healthcare provider or a doctor who focuses on treating peripheral neuropathy. If you found value in this video, please like and share it so more people living with neuropathy can discover these safe, natural ways to test and support their healing. I'm building this channel to be the #1 resource on peripheral neuropathy on YouTube, so your engagement helps more people find real answers and hope, because you matter. If you have any questions, drop them below. I reply to every message. Subscribe now if you're looking for more natural relief, proven daily routines, and real-world solutions for peripheral neuropathy that actually work. And the next video you should watch is this one right here. It shows you the best blood flow exercises to quickly improve circulation in your legs and feet so your nerves can start healing faster.